let me rewind back to the 1960s, and I'll just take 2-3 minutes to summarize, last almost 70, 80 years. 1960s, the general practitioner was the center of healthcare. People used to go to this doctor. He knew everybody in your family, and people trusted this guy. What started changing in the 70s and 80s is as science and technology advanced. CT scan came up in the early 70s, and by 80s, MRI technology came in, diagnostic technologies improved, surgical technologies improved, ICU technologies improved, which on one hand led to improvement of healthcare outcomes, but it also led to increased capex requirements.
Right.
An MRI machine cost a few $1 million. So how is a GP going to afford an MRI machine? Not possible. In parallel, in the healthcare side, knowledge expanded, partly driven by these diagnostic techniques and treatment techniques. When I was a surgery resident, my professor was a general surgeon. He could operate on a varicose vein, he could operate on the liver, and he could operate on the heart. Fast forward 20 years, nobody can, right? And pretty much nobody can, because you have to specialize. Just knowing enough about the liver, in fact, nowadays there are liver transplant surgeons who are different from hepatic surgeons. A liver cancer will be done by somebody else and a liver transplant will be done by somebody. So that is a level of knowledge that is required to be mastered. So on one hand, specialization, on the other hand, increasing cost led to the emergence of hospitals. Not emergence, or more, what should I say, power going to the hospitals away from the doctors.
Yeah.
Then, and then you saw in India, if you talk about, you saw Dr. Pratapa Reddy setting up Apollo, Dr. Naresh Chan setting up Escorts, Dr. Devi Shetty setting up Narayana. So a bunch of these doctor entrepreneurs came and set up these hospital chains. But if you now come to 2010s, the real power lies with the ability to raise capital. Right? So therefore, now what you're seeing is more private equity coming into hospitals.
Yeah.
So why I'm saying all this is that the power of the doctor in influencing healthcare has shrunken over the last 50, 60 years. It has become more of a technical expert and not the driver of the ecosystem. Whereas the managers, the financiers, the investors have become more important. Now, in all of this, the patient still trusts the doctor.
Absolutely.
Right? The patient still trusts the doctor. Despite whatever criticism may happen, finally, if the doctor says, don't do this, no matter what the CEO of the hospital may say, no matter what the pharma company may say, no matter what the medtech device company may say, a family will trust the doctor. Right? So, I think these macro trends of increasing specialization, increasingly expensive technology becoming available, which leads to better outcomes on the diagnostic side as well as on the treatment side, has done some improvements, but the trust factor between the doctor and the patient remains. And in fact, if you go back to that presentation that you're talking about, I've always made the point that the center of the healthcare universe is the doctor-patient relationship. From that arises pharmaceutical industry, because the doctor writes a prescription. From that arises the labs and diagnostic, because the doctor says, I want you to do this lab test, I want you to do this MRI. From that arises the need for a hospital, because the doctor says, oh, you need to have an appendix surgery, you need to get admitted for a hospital. So I think if we go back to this configuration of building tools which strengthen the doctor-patient relationship, and then we are more aligned with how citizens view healthcare.
Right.
Rather than, oh, doctor is insignificant. If you don't have one doctor, I'll shift to the other doctor. People have tried it. I don't think it works.
Yeah.
I don't think citizens find it. I'm calling them citizens, not patients, because not everybody is a patient, but people don't find it very fruitful. It's not like a restaurant that you don't like one food, you go to another one.
Yeah.
A doctor-patient relationship remains almost a lifelong thing. You are literally handing your life to the doctor. That, sir, please go fix my heart.
Right.
What more? Where else would you need more trust?
Yeah.
That I'm allowing you to cut me open and fix my heart or my brain or my kidney or whatever, right?
Yeah.
So that that need for trust is not going to go away. So the technology companies have to learn how to build on that trust rather than how to minimize or make fun of that trust.
Right.
It's not going to go away.
Yeah.